Okay, so Medicare for all, healthcare and activism. You are an advocate for Medicare for all, and one of the things that and it has been missed upon me, what has been said in the chat. You have some that feel that Medicare for all is just bad because giving Medicare to everybody, Medicare is still faulty. I'm going to give an explanation as to what Medicare for all is because I actually read Bernie Sanders' Senate bill, the entire thing. And so here's how it goes. Now, one of the things that I want to bring out is that Kat Terrell says Medicare sucks and I don't want everyone to deal with all the robberies, so quit Medicare for all slogan and advocacy, please. Here's the thing. Number one, Medicare for all is not the same as regular Medicare. How do I know? I have Medicare. Medicare for all, Medicare, okay, start off with Medicare. Medicare is actually the federal government program that pays 80% of your hospital bills, right? The difference is Medicare for all is fully comprehensive. Medicare for all will pay 100% of your hospital bills. Secondly, Medicare does not cover auditory, vision, or dental, or long-term care. That's what Medicare does not cover. Medicare for all, according to the bill, would cover auditory, dental, vision, and long-term care. Also, as far as the other point that was made, Catrell says people on Medicare still going bankrupt off medical bills. Feel that, damn it. Yeah, because that's Medicare. But Medicare for all means that you actually you get taxed 4% on your taxes after $29,000 per year. So anyone who makes under $29,000 per year actually does not get any taxes on their Medicare for all, and actually they basically essentially get Medicare for all for free. Anybody who is above 29,000 is 4% on anyone who makes above 29,000. So actually, the more you make, the more you pay into the system. So also, when it comes to medications, it is capped at $200 per year, which comes out to about $16 per month for your medications. So that's the actual crux of Medicare for all. There's a difference between Medicare for all and Medicare. Because if I have Medicare for all, I wouldn't have to pay the Medicare premiums that I get charged every single year, and which would save me a lot of money. So this is why single payer healthcare is an improvement. Now, I want a full nationalized healthcare system because I think that it should also be, nationalized as far as doctors, hospitals, clinics, the whole shebang, because, well, they're going to try to, take so much from the government, even if we had single payer healthcare. But single payer healthcare is a deep step in the right direction. So that's the thing about Medicare. So I just wanted to make sure I include that as far as the facts. So I want to include our guests. So wonderful to have all of you join. I hope that my I hope that my explanation of it was satisfactory.
Yeah, and I absolutely, and we hear that all the time. I just want to clarify that it's actually national improved Medicare for all. So that's where that, and sometimes we do like hashtag NEMA. So I mean, thank you, Bernie, for making it a household term. But unfortunately, he said Medicare for all, and it just kind of started that everyone calls it Medicare for all, and Medicare does suck. It's better than most of what we have, but we don't do better. We want it all.
Mm-hmm. Yeah. So National Improved Medicare for All. I stand corrected. Thank you, Joy.
Oh, no, it's all good.
Right.
Medicare for all is very misleading. I totally understand why, not to you, but to anyone having questions in the comments. So it's, yeah, definitely, I think going with National Improved Medicare for All or single payer is just the more people seem to respond to us more when we say it that way.
Got it. Got it. Thank you so much. Now, I would like to introduce the guests as well. And we're going to start clockwise. Mary, if you can introduce yourself and let us know who you are and who you're with.
Sure. My name is Mary Garish, and I'm actually joining you from Bennington, Vermont this evening. And I am with March for Medicare for All, and numerous other organizations that are healthcare organizations that have been advocating for many years, actually, for the kind of universal healthcare system that almost every other industrialized country has, and we don't. And trying to educate folks as to why there seems to be confusion about the Affordable Care Act and the government touting that as a healthcare measure when in fact it has nothing to do with healthcare, because healthcare isn't health insurance. I'm not sure if that's what you wanted, but anyway, that's what I have to say.
All right, thank you so much. Now we have Elizabeth. Please introduce yourself and what you do in the movement, basically.
Well, hello, beautiful humans, and happy Sunday. Thank you so much for having us here today. I really actually just want to take a moment really quickly to thank everyone at RBN for everything that you do, not only virtually educating the masses, but also in communities. It's really important what you're doing. So I'm really grateful to be here. I'm a little nervous. I'm not really an on-screen person. I'm more of a in the background behind the scenes type, but I am a national organizer. What?
I got some edibles if you want to chill out. I'm just kidding.
Oh, honey,
I told you we were gonna have fun.
You're talking to the right girl. So I am a national organizer with March Medicare for All, but I really view it more so as like a volunteer to this country, because healthcare is a human right and all of us deserve it. So the work that I'm doing is not just for some people, it's for all people. And that's what I'm here to do and talk about. Thank you for having us.
Thank you very much, Elizabeth. Now we have Martha. Hello, Martha.
Hi, how are you? Thank you so much for inviting me. Well, I'm also with March for Medicare for All, working on this complaint to the UN Human Rights Council on the gross violations of healthcare in the US. I'm also very active in the National Lawyers Guild. I'm a retired lawyer and have been doing various kinds of human rights activism and legal work for some time. And I used to be a union and community organizer as well.
We love y'all.
I got a lot of perspectives.
Definitely. So as far as this action is concerned, why go this route? And I'm going to start with you, Joy. Why go this route with going to the United Nations about this? And, Mary, Elizabeth, and Martha, if, please feel free to jump in whenever you feel like.
I think, to me, it's, and not to belittle anything we've done or, the other national supporters have done. But I feel like we've done the marching, we've done the rallies, we've done the protests. Now what? And honestly, the thought of the UN having to read an official complaint from United States citizens on how egregious our lack of healthcare or insufficient healthcare is, and the numbers of people who are dying, the numbers of people suffering. These are people from other countries who are going to have to read this. If it was Americans, I'd say, whatever, they're not going to care anyway. These are people from countries who have the healthcare we want. And when I talk to people in UK and such, they say, what is wrong with your country? That's the reaction we want right there. We want other countries to read this complaint, hear about this complaint, and say, you know what? US needs to be held accountable. This is unacceptable. This is a human rights violation. And these people we're watching eugenics of the poor. They are being completely ignored. And the thought of that is pretty exciting.
Yeah, I'd like to jump in too and say that at the United Nations, the US has managed to create an aura and in some cases to pay for the privilege of not having to conform to the international law, including the law of human rights. And what we want to do is expose that. We want the exceptionalism of the US to be the focus. And the US, it's the number one country for the cost of healthcare. It's the number one country for the profits made by healthcare industry. And we had the largest number of deaths from COVID. We have a really colossal problem here. And we have to bring it to the world community, this, what's going on here, because we need to have the solidarity of people in other countries, whether they're civil society, NGOs, or other states that do have health care, recognize their obligations, and are going to ask the US what the heck is going on.
I totally agree with everything that's been said. And to those points, I would also like to say that typically when there are these reviews in Geneva at the UN of the United States, like there is of every country that belongs to the UN gets reviewed in terms of, so the United States has managed to, not only do they have all of us thinking that, oh, they've passed great laws and our healthcare is going to be really good now with the Affordable Care Act. And they have us thinking that healthcare isn't yet a right. Okay. Now, the international community knows very well that healthcare is a right. Yes. But the international community also has been, they've been lied to by the United States. I'm just going to be blunt, because when the United States government goes over there and talks about health and health insurance, the international community doesn't really get what they're talking about, because the word health insurance is used, for example, for the national health system in Britain. It's used in France, it's used in Germany, but their quote insurance is a national program, which is sometimes supplemented by a private company, but always a non-profit company. So they don't even conceive that insurers in this country profit off of our suffering, and that's why they're so hard to get rid of, especially when they make nice with all the legislators who at least pretend to believe, if they don't believe, that the insurance companies are actually helping us out. So this will do a few things, in my opinion. One, it will let the international community know that just because the US says, oh, we've got this great Affordable Care Act and we've got this great insurance and, blah, 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 they need to know that's not what they would think of when they think of health insurance. And for all the folks here who are ignored and whose suffering causes very big profits and huge bonuses to insurance company CEOs. The folks here in this country need to be empowered to, one, know that healthcare is a human right and be able to actually do something about it with the support of the world, because we already know the government isn't listening to just us.
Mm-hmm. Yeah,
I'll add to that too. I definitely agree with all of these wonderful women on the panel today. But I also want to just mention that this has never been attempted before. This is a historic action that all of these legacy organizations who've existed for however long, pretending that they're fighting for a national health system or Medicare for all or single payer or universal health care, none of them have done this. So it's just another thing that March for Medicare for All will be accomplishing that's historic, along with the July 21st, or excuse me, July 24th, 2021, 56 actions across the country in one Solidarity Day. I'm just blown away that these legacy orgs have not done anything. So they're continuing to gather your stories, they're continuing to ask for your donations, and they're not actually doing any of the work to get the legislation they're claiming to fight for. So it's time that we do something about that. And this is historic. So if you want to share a story with us, or you are part of an organization that might be interested in joining this complaint, we want as many organizations as possible to join this, because we want it to be big. And if you have connections outside of this country, international members that are interested in healthcare for the United States, I mean, please connect them with us, send us an email. You can send us a message through the website. All of that. We just need to get this far and wide and as many people on it as possible. And what we really need to do, we're not sure how far this is going to go. I mean, we know that we have an imperialist government who has their boot on everyone's throats across the world. So we don't know how far it's going to go. And the fact that it's just never been done before, we have to do this because it's another form of getting us to where we want to go. And I really am pleading with everyone. We're not gathering your stories for poverty porn like politicians do. How would healthcare change your life? No, that's not this. We're getting your testimony as an individual in this country who is failing to provide you with healthcare. You are a human. You deserve healthcare. Your story is evidence in this complaint against the United States government, and I would love to shame them across this entire world and make them give us what we deserve. The purpose that we have a government for is to take care of the people, and they are failing us. We need healthcare, and this is one of the steps to get there.
And I mean, you think, how many times do we hear or see healthcare is a human right? It's not. Not to our country. It's not. If it was, we'd have it. So
I recognize, but I would say it is a human right.
Yes.
Claiming
I mean, literally.
What we're doing with this complaint is using the international law principles like universal access and non-discrimination and equity and the highest attainable standard of physical and mental health care and transparency and participation. These are all international standards that other countries feel obligated to conform to, but the US has basically snubbed the international law and disregarded these basic legal principles. So what we've done with our we have a form that you can fill out. We have, when you go to the website, you'll see some of our suggestions about the stories of the evidence that we'd like to get. And for example, universal access, that there's so many people who can't afford to use the health care that they have because they have high deductibles. And then there's like the outrageously horrible standard of care, the quality is so terrible in prisoner care. I mean, it's just, there's so many stories out there. So we know, and there's whole groups of people who don't have access, immigrants, a lot of immigrants. And we want people to, you know, participate and join this effort so that we can help people claim their right to health care by actually pointing out where the failings are in the system.
Yeah, and I particularly would like to emphasize, as did Marty, that one of the key factors in this fight is that even healthcare activists, I hear them say all the time, we have to make healthcare a human right. Healthcare is a human right, okay? The United States has signed treaties, and I know I've said this before, so I apologize to anybody for whom I'm repeating myself, but and I'm talking about treaties, like those official international documents that end wars that the US wouldn't dare to violate. Well, there are certain treaties that have been actually, well, a lot of them have been signed by Congress. A lot more have been what's called ratified, which means you don't dare step over those boundaries. And in very many of these, it talks about the right to health care and the right to equity and the right to life, which includes living a healthy life and includes, and equity, again, it's not equality, okay? It's that you get what you need, not that somebody decides what somebody else with your condition needs, and that's what you're going to get. You get what you need, no matter who you are, no matter where you're from, no matter what your economic status or anything else, or citizenship status, as Marty was saying. And I think
that's also equality, Mary, because
yes,
the
well, there is, but
and equality, you know, everybody should have equal facilities to go to.
Right.
Like the hospitals should be equal in poor neighborhoods as well as rich neighborhoods, you know, or the clinics. So
you're absolutely right. I was only wanting to distinguish that because insurance companies, when they are setting forth their list of covered services, okay, like everybody can get these things, and so you're all equal. Well, no, first of all, you're not equal anyway, because it depends on your copay, it depends on your deductible, it depends on whether you can even afford insurance. But also you're not equal because just because what I need isn't on that list doesn't mean I shouldn't get it. So it's a blend of both. You're right. It's equality in terms of access and facility, and equity in terms of the treatment that you need.
Yes. Yes.
And if I may just finish where I was going, when I was saying it's not a human right, I was going to finish and say to politicians.
Right, exactly.
So is it to me? Of course. Is it to millions of people? Absolutely. But what I was gonna, get to is that by politicians, it's not a human right. And then Biden tweeted, "Healthcare is a human right."
He did.
Biden. Okay, so this is
a slogan for them.
A slogan, and that's where we have to say human right. If this is a human right, and we're all saying it's a human right, then what do? We make a human rights complaint. That is the next step.
He weaponizes that, Joy.
What's that?
Biden, like many politicians, weaponizes human rights. They
do
it all the time. And they use it against our movement, which is why we have to be clever. We have to take it apart. We have to know what it means to claim a human right. Like universal access. Okay, how come all these people are left out? Just tell us what kind of system you have in mind that leaves so many millions of people out of the healthcare system.
Right.
Thank you very much for that. Now, I have a question that I wanted to also pose to you all to answer. What do you say to people who say that the world leaders won't listen? So why take part in this submitting this complaint to the United Nations?
Well, I think that part of it is it depends on who you're envisioning as a world leader here. Because so we're not talking about like the president of a country or the dictator of a country or whatever the circumstances might be. We're talking about their UN presence, and we're talking about the Human Rights Commission of the United Nations. And there is a difference. There's a big difference because, at least in my opinion, almost any country, if you're talking about a world leader, I mean, who could be considered a world leader? Putin, Biden, take your pick. They're not the ones that we're appealing to. We're appealing to the Human Rights Commission of the United Nations, which is supposed to stand up to, they're supposed to give the message to the country's representative, who then takes it back to that world leader and says, people are saying that we're violating rights. And the US hopefully is always the first one to say that other countries are violating people's rights. So they need to know that they're violating people's rights.
But I kind of disagree, about the, I can see people's point that, is the UN really going to do anything? Right. That's a good question.
We don't know.
And the Human Rights Council, it's just 48 states. And this complaint goes to a committee of a working group of 5 states that looks at it. But I will say that one of the countries on the working group is China. And China certainly has a different view about human rights and certainly about the right to health than the United States, just based on the COVID pandemic and the number of people who died. So we know that there's a difference of opinion about what the US is doing and the US record within this council. And so the Human Rights Council is it's a mechanism. I would also mention that although this is the first example, to my knowledge, of a group of organizations filing a complaint about a social and economic right, the right to health, against a rich country. All the previous gross violations complaints are against Asian, African, and Latin American countries, as the usual, right? They have to do often with civil rights issues. And I think it's about time that the richer countries, the white, majorities in those countries actually get held accountable for their human rights records. There's a lot of interesting politics going on now in the UN system. And I think that we can get some kind of consideration filing this complaint at this time because of the way the whole UN system is being challenged.
That's true. And usually, so when we've been over in Geneva at the UN, not on a complaint, but on any of these reviews that they do periodically, it's very interesting because the European press, whether it's Al Jazeera or whether it's, no matter what country it is, they pick up on all of this right away. They want this. They want to put out the stories about how the U.S. is being criticized and what for, versus our press here in the United States who aren't so willing to do so.
Well, I'm not sure the press in the U.S. even understands what a human right is either.
Well, no, but
if you notice, even the progressive media in the U.S., they will talk about human rights and social justice, for example. They will put the right to health as if it's an issue of social justice, but not a right, and so they create these binaries of understanding that actually tend to just substantiate the misinformation in the U.S. This idea about the right to health, of course, goes back to the Cold War, because what happened during the Cold War is that the U.S. refused to ratify the Covenant on Economic, Social, and Cultural Rights. We signed that treaty, and it still hasn't been ratified. It went to the Senate in the 70s. It's still waiting to be ratified. That has the main codification of the right to health. However, the U.S. did ratify the Convention on the Elimination of All Forms of Racial Discrimination, which does also have a right to health in it, which the U.S. just blithely ignores. And, you know, like African American women have one of the highest rates of maternal mortality, for example, but somehow that just can't, you know, get the attention in these reviews. So I think that, yeah, anyway, so
well, no, you're right.
And that, but there is a problem with the way the right to health is treated as a human right, even in the media.
Oh, I may have misspoke. I think our media here does not treat it. I mean, they don't. You're right. They don't know it's a right. They don't call it a right. They get it all confused. What I was trying to say was that when we're in Geneva, and if we're talking about the human right to health, and they have a press conference at the Geneva Press Club, that a lot of the international news stations, they may not quite get, depending on what country they're from, the fact that healthcare is a human right, but they will certainly publicize the fact that we're complaining that the U.S. doesn't do it. That's what I was trying to say.
We don't even get covered, is what you're saying. Yeah.
Right.
And for anyone who says, why do this? Why not? I mean, I don't understand why people who are like leftists are always like, what's the point? Look, we're the ones volunteering our time and energy into this. We're not asking you to help. I mean, we'd love your support, but what, you know, every time we post about it, we get comments like that. What's the point? Well, the point is, if it gets other countries talking about it and the US is held accountable, even verbally, that's the point.
Yeah.
You know,
exactly.
That's also an example, what you're saying, you know, when people say, what's the point? What's the point? Why do it? That's also an example of how American exceptionalism has penetrated our entire society. It affects right, left, center, all kinds of political tendencies. You find people saying, you know, a lot of people, including lawyers, will say there's no such thing as international law of human rights, you know, or they will say, oh, well, international law, you know, what's that? It's not really important. And it's so interesting because whenever, for example, the Biden administration wants to get some points, they'll be pointing the finger at some other country about violating international law, right? But it only goes in one direction, against the countries that aren't considered allies. But and anyway, so I think that we've talked ourselves into a corner, you know, of excluding ourselves from the rest of the world, and also in terms of our movement of making common cause with people in other countries, like activists in other countries. They know how to use human rights as a framework to help their struggles. But
look at Haiti. Look at them today. Americans don't do what other countries do.
Right.
They don't have solidarity like other countries who are like, yo, let's get in the streets, let's do this. I don't know if we ever will. So that's why doing things like this is so important.
And I'll just add to that. Oh, I'm sorry.
Sure. No, please go ahead.
Oh, I'll just add to that. I think that that's one of the tactics and strategies that they have. I already mentioned, I don't know how far this is going to go with the UN. I don't trust our politicians, our government. I don't trust the predator class. I don't trust any of the elite. I don't trust the global WEF. Like, I don't trust any of this. But here's the thing. They want us to be dumb and numb and have malaise and not fight for our own rights. And I'm one of the people who is willing to die for the right for the rest of this country to have health care. And we need more people like that are going to continue this fight, whether it be for health care, whether it be for climate change, whether it be for housing, whether it be for jobs, whether it be for food stability, like whatever the case may be, we have to keep fighting. A lot of people will say, oh, well, no, you just need to do it in your own community. Just do it all in your own community. The propaganda machine, which is our mainstream media in this country, has spent a lot of time perfecting the ability to divide us. They want us to hate each other. They don't want us to work together. And so for anyone to say, well, why do this? If you're not interested, that's perfectly fine. But you need to be working on something. You have to be building something. You have to be fighting for something. Otherwise, they're going to win. And we can't let these bastards beat us down. We have to keep fighting.
And so, as long as they can keep, I'm sorry.
No, go ahead, please.
As long as they can keep us scrambling under the table, fighting each other for the crumbs, we will never be sitting at the table sharing the meal.
Correct.
Well, so human rights is a vision too. You know, it's a vision, a more complete vision of what we want. And so it gives us a way also to, I think, you know, a lot of people are so disheartened and discouraged, and it gives people a common language that we can use, you know, across the board here and globally. Sorry.
Yep. No, it's quite all right. So this was kind of a question, but it's more of a statement. And I just wanted to get your perspective about what I'm about to say. It's kind of an analogy. So one thing that a lot of people don't realize, or they realize as they find out what the United States is actually doing, is that we are not the only ones that are propagandized. Like Nick always says that the United States is the most propagandized country in the world. However, one thing I also notice is that people of other nations are also fed United States propaganda about the United States. And so they have in their mind, oh, the land of opportunity, freedom. You have all these beautiful things about the United States until they get here. And so it feels like this submitting it to the United Nations is basically taking a bucket of ice water and splashing it on the face of all the people who are abroad who fed into the U.S. propaganda, who drank the U.S. propaganda Kool-Aid, and it's waking them up to say, wait, the United States isn't what you think it is. Anybody want to comment on that, please?
And you know, another thing related to that is that the U.S. spends millions of dollars through the National Endowment for Democracy of propagandizing for human rights. If you look at the grants that they give to destabilize other countries, almost all of them have democracy or human rights in their titles. And so you can see this this disinformation and machine is really actually quite elaborate. So we're always dealing with that, but I think that I actually think that a lot of people in other countries know a lot more than people do in the US, that's part of the problem, is that the propaganda is to make Americans not rise up to ask for things that other people actually have achieved. For example, like a national health system. And even now, this discussion, we could take this a little further from like Medicare for all to the whole question, which is going to be coming up, of whether we should have, privately delivered health care through Medicare for all type of system, or whether we should have a national health service where where all the physicians are employees of the government, like what a lot of people call socialism, but some kind of system like that in the US because of the nature of capital, how capital is evolving here and the health industry. So
Yeah, that doesn't scare me because I'm literally a socialist. So keep on speaking.
So many
That's
of
music
us.
to my ears.
But it's very interesting to that point, Marty, because I know that going back years and trying to get folks involved, we had a lot of stories from older folks who couldn't afford the treatment they wanted, that sort of thing. But they were so glad to have Medicare. So when we were talking about a united single payer national health system, they're like, oh no, I don't want any laws on healthcare. I don't want my Medicare taken away. I don't want my Medicare taken away because that's the only thing that's saving us. And we're going, but what you're not getting is we're trying to do Medicare and better. So you're not going to get it taken away. You're going to get it improved. And it's very hard for people to understand that. And I can recall when Medicare first came into being. And there was a big to-do in Washington about it. You know, a lot of people were against it. And the hope was that it would progress, but instead it's kind of stalled where it is.
Well,
so
it's been privatized. It's being privatized as we speak.
Worse.
You know? Yeah. It's underway with Medicare. And that's another aspect of this, you know, is to try to get more attention on the commodification and the unbelievable profits that are being squeezed out of people in this system, and how it leads to, you know, a complete perversion of the health system. It exists to channel profits to the insurance companies. I mean, that was the Affordable Care Act. You know, it brought the insurance companies' profits were declining, and you know they're doing great now.
Elizabeth, can you touch on DCEs? Because I know I get, like, when I talk about that, people are so confused, and many people have no idea what it is.
I mean, it's just the privatization of Medicare. DCEs have been rebranded from direct contracting entities to ACO REACH, which is, I can't remember what it breaks down to, but it's like empowering, and just this stupid rebranding that they did to try and trick, you know, our elderly into believing that it's gone from a direct contracting entity for privatization to this cool thing that's going to allow access for all people, regardless of where they're
equity in it.
And so
with equity.
That's the thing, is a lot of people don't really understand. I'm from the country. I grew up on a 10-acre farm in a small town, population 514. We didn't have a stoplight. I grew up on a gravel road. Like, I am country. And so a lot of people don't realize that community clinics are being bought up by these direct contracting entities, private equity. And then when it's determined that they are not profitable, which healthcare is not profitable, it will always cost money. It always will. And so when they realize that they're not going to make the profit that they want out of that clinic, they shut it down. So then the people in the rural areas have to drive even further. And a lot of people that I know either don't have a vehicle, don't have the money for gas to put in that vehicle, especially now, can't afford to renew the tags on there, can't get their license renewed, can't afford to do that, you know, and so that's creating even more barriers. But they brand it as like this amazing thing that if we don't do this privatization and allow these, you know, hedge funds and private equity groups to manage all of this, then our healthcare is just going to go nowhere. And it's really time for us to imagine a better society. I feel like everything, all the work that all of these activists that you've had throughout this weekend, and even in past summits that you've done, it's really laying the groundwork for a general strike, where we need to have a list of demands and we don't do anything for this country. We create nothing for them until we get our demands met with zero negotiations. We really need to imagine something better for, you know, the future of this country and the planet. I mean, ultimately, what we're doing here in this country is impacting so many others across the globe. So, but one of the things that we're exporting is privatization. We see that has gone across the pond. and they're trying to take down the national health system in the UK and privatize it. And that's not okay, which is why we really need to connect very much so with those outlets in the UK, journalists and organizations, to come on board and realize that what we're fighting for is also fighting for them too, so they can continue to have their national health system and not allow the privatization to go any further.
Okay, so for the naysayers in this group, some of them are in the chat. Can you all explain why the privatization of healthcare, especially from the aspect of health insurance, is detrimental to those of us, especially those of us who are disenfranchised? And anybody can pick this up.
Well, I'm sure we all have a lot to say. Go ahead.
I feel like
Mary,
that's
as an indigenous
already
person,
answered.
Let's
a
go.
lot of little pieces, but I mean, one of the issues right away is that if you have a healthcare system that is extremely complicated and requires middle managers all over the place, which is what insurance companies are, they're managing the care that you should be getting directly from your physician or your dentist or whatever. But if you have, basically it's set up to channel profits to the people who manage the system. So to create, new sources of value. And so instead of delivering healthcare to people, so and it creates an incentive, of course, and this is what's happening with Medicare Advantage, for example, the privatized so-called alternative to Medicare, which now is predicted to be, it's like more than 50% because of this unbelievable fraudulent advertising on television and and extra payments to the insurance brokers who sell it rather than and so people think, oh, I like that, I get the silver sneakers and I'm going to get vision care, but they don't even know that. And so Congress keeps guaranteeing the profits. They guarantee the profits to the insurers because it costs more. It costs more and it delivers less. And then they reduce who you can go to. So you can't go to the doctors that you need, or your care is denied and you have to appeal.
And not only that, but
I just wanted to ask. So, Martha, are you saying that the insurance company is a middleman that really puts a barrier between you
don't
and
need
your
them?
doctor?
You don't need insurance companies at all. You don't need them at all. They're totally useless. They exist to take money. They manage the care. You don't. And so, with regular Medicare, like, can you believe, like, there's all these ads saying, oh, it's open, open enrollment every fall. They say open enrollment for Medicare. Well, if, like me, I have Part B Medicare, I don't have to sign up every year. I already signed up when I was 65. Hey, it's done, Anyway, but they make it sound like you have to pick an insurance company and, that anyway, so people, but yes, it's true that it's designed to send profits to the private sector. That's exactly how it's designed. And since Medicare was adopted, there has been a constant trend year after year to privatize. I mean, that is foreseeable in a capitalist system that it would always be under attack, but it's why we have to push ahead.
It also terribly increases the costs of operating a hospital or a doctor's office. And the reason is because the paperwork that the hospital and the doctor have to fill out is so voluminous and has so many different codes on it, they need to hire all these people to do nothing but send the insurance company bills, when in fact they could be spending that money on paying their nursing staff or their doctors. And in fact, I have an example because I live in Bennington, I said, and it's a relatively small town compared to like New York or any large city. Sure. So our hospital here has 3 floors, and one whole floor is devoted to billing services. Now, that's because of all this insurance company paperwork. If they didn't have to do that, and it was like a national health system, they don't have billing offices at hospitals. So people are complaining about, yeah, no, they don't. I mean, like, you literally, one of our legislators here in Vermont got hurt when he was in Europe, and it was in France, actually. And he broke his leg, and they took him to the emergency room, and they set it, and they did everything. And he's like, "Where do I pay my bill?" And they said, "What?" And he said, "Where's your billing department so I can pay?" And they said, "We don't have a billing department." "What do you mean billing department?" And he was appalled that there was no billing department where he could find out how much he owed. And he was further appalled to find out he didn't know anything, because this is a service at the emergency room, which is totally covered by, regardless of your citizenship. So it's just like, it shortcuts the procedure. It's like you had a card and they swipe your card and that's it. The government does the rest, instead of having hundreds of employees, both at insurance companies and at hospitals, getting involved in this.
JP, can you repeat the question? And then Mary, maybe you can answer from the Indigenous perspective. I think we got kind of off track.
So what do you say to people who, I'm sorry, I'm trying to remember the question.
I think it was about like equity, people who are disenfranchised, unless I'm hallucinating.
Right. So, and I did notice thank you for pointing that out, Joy, because I actually noticed a comment from somebody in the chat, I don't know who it was, about saying, well, of course, they don't keep any treaties. What about all the treaties with Indigenous peoples? And here, that's absolutely correct. However, though, and those have also gone to the UN recently, okay? And the health services are particularly appalling for folks on the reservations. And I just, I have a friend whose mom moved from one state to another, still on a reservation, and she couldn't get the services she needed in Washington, the state of Washington, because the Indian Health Services office, she wasn't registered at that one. She was registered at the one in South Dakota. So they had to drive from the state of Washington to the state of South Dakota. So, and with COVID, we know there was a report actually submitted by some groups, the Bringing Human Rights Home Lawyers Network. And what they had is we did a report on COVID and how it's affected people that are in any way marginalized. And one of the big populations that it impacted the most were all people of color, and including Indigenous people to a very large extent, and all people that were below the poverty level, because they couldn't afford to go anywhere and get any treatment. So I'm not sure if that answers the question, Savage.
Yeah. I think so.
Okay.
But yeah, I mean, just to touch on that, for national improved Medicare for all, there is literally no one who would benefit more than Black, disadvantaged women who are poor, or and I mean, like, this is specifically to not, one of the benefits of this is to help the disenfranchised, the most marginalized. You are going to see people, helped, who are people of color, the disabled, the poor. I mean, homeless people on the street, they're going to be able to get treatment. People, it will literally help every single person, even immigrants. Where you live is irrelevant. It makes, who cares? You deserve healthcare, period.
maybe it's just me and I'm channeling my inner spirit of savage joy, but I'm going to give a little snappy comment right now. So I'm going to explain for the private insurance lovers that are in the chat right now exactly how it actually works within this country. So here's how it works. So private insurers, they have to make a little thing called profit. With profit, that means that whenever they take in all this money, in order for them to make more profit, they have to deny you care so that they can continue to keep that money within their coffers for their shareholders as well as their CEOs. So whenever you have an emergency, guess what? They're going to say, well, it's not in network, or you know what? That's a test I don't think that you need. And so guess what? The people that are at the top of these insurance companies, the ones who back in the day, they used to say death panels. Guess what? They're the people who are the heads of the insurance companies. So these death panels are literally saying to grandma and grandpa, no, we're not going to pay for your insurance. We're going to let you die because it's actually cheaper and we don't have to pay anything out. So this is the point of private insurance. And this is why you want to get rid of them, because they are a mafia middleman, which actually makes it so that we die quickly because they don't want to pay the money out, even though we put all this money in. So this is one of the reasons why National Improved Medicare for All, or in my case that I would love, a nationalized healthcare system is actually better. So not just the richest people can have gold star platinum healthcare, but even the people who are living out on the street can also have platinum healthcare, because healthcare is a human right. I hope I explained that very well to anybody who's a private insurance cover in the chat, but that's how it works. Welcome to RBN.
And as a human rights matter, everybody's entitled to platinum level care too. That's that's a total violation of the right to health care. That's a total violation of the principles of human rights.
And I'll drop a little savage joy myself, okay?
Yeah.
Because I'm just going to say, the only people who say stuff like that have the privilege of saying that. So before we get to why cut privatization out and stuff, talk to poor people, talk to disenfranchised people, talk to the millions of us with medical debt, talk to people who are actually hurting. And let them explain why. Because if you're privileged enough not to understand that, please go to someone who can teach you, and be thankful it's not you. Because in the future, it may be you, a family member, a friend. Don't wait till you get to that point. Start.
And by the way, let me add this as well. If you are saying that healthcare is not a right, that means that you're telling people like myself and everybody on this panel that because you don't make enough money, you deserve to die.
Right.
That's what you're saying.
Or to be
and people are like, oh, don't put words in my mouth. No, I'm putting words in your mouth because that's exactly what you're implying. Is that we deserve to die simply because of circumstances that may have befallen us. And do not come to me saying, oh, well, you made poor healthcare choices, so that's on you. The thing is that we live in a capitalist system. Yep, that's right. I'm going to go on my socialist rant. Welcome to RBN. You live in a capitalist system that is predicated on making as much profit off people as they possibly can. So guess what? They're going to use that in order to exploit you, in order to downgrade your health. So guess what? One hand feeds the other. So guess what? The health insurance industry feeds the big pharmaceutical industry. Big pharmaceutical industry feeds big agriculture. Big agriculture feeds all these different industries in order to create and maximize more profit. So guess what? This is one of the reasons why somebody like me is anti-capitalist, because guess what? It will actually save lives. Please go ahead.
You know, there's another issue here, though, for even those people who don't think that, they're not compelled by the issues about equity and justice for people who are low or no income. And that is that a national healthcare system that's funded through single payer financing actually equalizes equalizes the right to health care in the US, and actually would reduce mortality for everyone, not only people who are low income or minorities, but also it because there's this whole notion, which is very well substantiated by the research, of Wilkinson and others, and that shows that more unequal societies have worse health outcomes just because they're more unequal. And the health system is a perfect example of some of the worst inequalities in our society. And in fact, having a national health system would do a lot to reduce inequality and to improve the outcomes, including all these so-called social determinants of health. And we could have we could have a national system of gathering data and actually deal with some of the really horrible environmental pollution and other types of issues that are social determinants of health, which affect everybody. Air pollution after 2 weeks of smoke here in the Northwest, you realize every single person, you can't stay in your room with an air purifier for, forever, right? You have to go outside, and it affects everybody. Seattle was the worst, most polluted city in the entire world this past week.
Yeah. I'm sorry. Elizabeth, did you want to chime in as well?
I was just going to mention that not only would a national health system help, marginalized people, but also like incarcerated people who are getting just subpar care in jails and prisons. Absolutely abysmal. I actually come from a dental background, and I've worked in the nonprofit sector. So I've helped a lot of people who are, recently got out of prison, didn't qualify for care yet in the state of Washington, and needed help, like for extractions, because they were not cared for while they were incarcerated. They have infections that would reinfect and things like that, causing ultimately death if you don't have it taken care of. So, I mean, we don't have a healthcare system in this country. We have a death care industrial complex, as you explained, JB. And we need to change that. We have to.
In fact, I can speak anecdotally to what you just said, because I literally lost my uncle who was in prison. He died in prison because they did not give him the adequate health care that should be afforded to every single human in this country.
Right.
So I know intimately about that.
I have one too. I know of one in Washington, a peace activist who is incarcerated, a nun who died because she had cancer and they didn't give her prompt care.
Thank you so very much.
Yeah.
Another thing I want to remind, I've really just worked a lot. I mean, I have 25 years of customer and patient service in my history, my work history. So I'm not highly educated. I graduated high school. I used what little savings I had to put myself through community college. No idea what I wanted to do with my life. Then I went to trade school. And so I'm a worker. That's who I am. I'm not a professional. I'm not an academic, I'm just a worker. And through all the jobs that I've had, every insurance policy has been crap. And I'll tell you, the current employer that I have right now, the policy that they literally to sign up for is called a high deductible policy. And not only that, they give you the options to buy in, meaning you can upgrade your high deductible policy, paying more so you have access to more providers. So you're just now at this point paying to see a doctor. That's all you're doing is like, well, will I need specialty care? I don't know. And I've actually, this last 2 months, I've been going through my own personal health issues that I've never experienced before. I've been to the urgent care twice. I've been to the ER twice. I've seen a surgeon for a consultation. I've had CTs. I need to go in for an MRI. I can't even tell you how many prescriptions at this point. And so I'm at a cross point, because either I push myself to work and go with this high deductible policy, or I quit my job so I can keep my Medicaid and take care of my personal health issues.
Yep.
Because I was actually fired in March of 2020, the first time I've ever been fired before, because I wouldn't sign a 2-year non-compete without getting a 50-cent raise. And the employer refused to do that. I know, it's ridiculous. And so he fired me on the spot. And when I filed for unemployment, I automatically got signed up for Medicaid. And I didn't know that. And this, at the end of 2021, my unemployment expired and all of that. So I just assumed that my Medicaid had expired as well. I got hired for a new job in June of 2022. And I didn't know that I still had Medicaid until I went to the urgent care in September. And they're like, oh, we see that you have active coverage right here. And so I was like, oh my gosh, you know, because I had pushed it so long to not go see a doctor because I didn't know how much I was going to have to pay. I'm already in debt.
Wow.
So I'm now at a cross point. Do I push myself to work and possibly get worse with my health condition and have crappy high deductible insurance that I buy into? Or do I quit my job and live in poverty, or continue living in poverty, so I can have my Medicaid insurance here in Washington State? So, I mean, that's the people who are saying, oh, what's wrong with privatization? There's too many things that are wrong with privatization.
Yeah.
I can't tell you. It's a scroll. It's not a list. It's a scroll. And
how many millions of us can you ask?
Right, exactly. And that's the thing, is that my story is not unique. And that's the really messed up part, is that it's across this country.
Yeah,
well,
there's some people need to talk about.
So many people delaying care because they're afraid of the bills, right?
Mm-hmm. Yep.
And or they're afraid. The other thing is, I'll just mention, you know, that there's another reason to have a national health system, like whether it's, you know, Medicare or a national health system. But Medicaid, of course, is means tested. And another problem that crops up, and I can speak from family experience too, is that you can go in and out of being eligible for Medicaid depending on your income, especially for contract workers or people who are low income, especially when they start calculating your income according to the last month or the last quarter, and you know, have erratic income. So many people are basically denied access to health care because of the nature of their work and their income. And so what we have is this really, we have a ton of people who might have nominal insurance, but they're way underinsured. So we have millions, you know, who are uninsured, who are underinsured, and who for various reasons can't use even the health insurance that they have. So the magnitude of the problem is much greater than it even appears. And and also these insurance companies, the rates that they bill at and the rates that they get paid at are just very interesting.
And JB, I'm so sorry. I noticed we are totally eating into the new panel. I'm so sorry.
What? No, you're not.
Oh, yeah.
No, you're not.
I thought it was at 6.
Keep going, baby. Keep going. Let's go.
I was just gonna say the most.
I wanted to give one example of a I know of a surgical procedure that a young woman had put off for a long time because of intermittent access to Medicaid. And then when the procedure, which did not involve more than a 1-day hospital stay, when the procedure actually took place and it was billed to Medicaid, it was billed at $100,000.
Oh my God.
And so, or what you see, and this is another thing about the privatization and how Medicare Advantage works, is the overbilling, the fraud. It's privatization builds fraud into the system. And that's bad public policy, you know, and to create incentives for fraud and, you know, fraud is maybe the not even the worst, but you know what they call overbilling is the typical situation where the upcoding and, you know, basically saying people are sicker than they are so that they can get paid more. And there's all these prosecutions, but they don't seem to be, you know, a few prosecutions now for Medicare Advantage overbilling, like Kaiser and
but
health. But there's so little of enforcement, even of the little regulation we have, you know, that I think actually we'd have a better system if it were a comprehensive system than this patchwork, this messy patchwork of all these privatized subsystems.
And the thing is, there is nowhere for people to go to get any relief. It's not like our government has refused for years to take the suggestion of the UN and establish our own national human rights council. Okay. So but we don't have that because we don't need it, because we all know that, you know, we're exceptional. But anyway, so then if people have literally nowhere to go, so you appeal the insurance company up the chain, and maybe if you're lucky enough to know that you might be able to get an attorney to sue the insurance company under a class action, then you might be able to get some money back. But the vast majority of people don't even know that there's anything they can do about it, let alone can they find an attorney who's willing to take on such a class action. So there is no other remedy other than the insurance company that's denying you. That is crazy, really crazy.
Yeah. There's a couple things that I wanted to bring up. And so we're talking about the privatization. This kind of goes into really, you know, hospitals, but, you know, of course, you know, private insurance can also benefit from this. I'm going to share my screen really quick. And you probably saw this statistic as well, but I really want to show this because I shared this before on my channel. So this is from Statuside. It says the number of all hospital beds in the United States from 1975 to 2019. Back in 1975, there was over 200 million Americans in the United States. Now we're over 330 million today. That being said, in 1975, there were 1,465,828 hospital beds in the United States. Did it go up commensurate with the population? No, it went down. So by 2019, it went down to 919,559 hospital beds. Any reason why that could be?
Sure. People can't afford to get hospital care, and so they can't use the beds because they don't have insurance and they don't get to go to the hospital when they need it.
Well, and private equity closes those beds when they don't make money, which they don't ever make money.
That too.
Well, even before private equity, they were closing hospitals and they were reorganizing hospitals. Like I used to be a union organizer for a union that represented healthcare workers, and they would make the workers rebid for their jobs. They would reorganize the entire hospital as a way to make it more profitable. This happened repeatedly, and make the workers rebid for jobs. They changed the jobs and basically ease out the workers. So while they were reducing the number of hospital beds, they were also reducing staffing. And that's all, you can see all the problems that then all it takes is one pandemic, right? For the thing to just completely go off the rails. But it's another way to, you reduce your costs and you increase your profits by reducing your costs.
So I have another question as well to for the panel. So hang on, where is it? Hang on, sorry. Oh, here it is. Okay. So there was a statistic that said that over 300,000 people's lives could have been saved during the pandemic.
Yeah.
Correct.
Would you say that the U.S. is guilty of eugenics via neglect?
I say that every day. We are watching eugenics of the poor. This Biden can sign an executive order to have healthcare for all our asses right now, but he doesn't care. So yes, this is absolutely
why we're filing this complaint. This 338,000 so-called excess deaths. I have trouble with that phrase. It's kind of disgusting on one level, but they're excess deaths and attributable to the fact that we don't have a single payer healthcare system, which is pretty amazing to be able to actually make the link between the type of healthcare system we have and mortality. But this is exactly one of the pieces of our gross violations of the right to health.
Right.
Because gross violations, which is what this complaint alleges, includes repeated violations. It includes severity. It encompasses the severity of violations. Surely dying is the arbitrary denial of the right to life is another issue here. I also would say it's not only the poor, like the first people who died during the pandemic were in basically a pretty fancy nursing home, although the workers didn't have sick leave in the nursing home. It's very close to where I live. The nursing homes, a lot of them are only really available to people who are pretty high income, high wealth. And so you could say that it also targeted old people, because, we know that. And speaking as an old person, I recognize that, but I think that it is one of the cornerstones really of the high mortality, which will suffer again. And we have like just this last week, according to the CDC, there's 323 people dying every day from COVID. It's not over. And so.
Well, and we need to remember that before COVID, we already had 68,000 deaths on average per year.
Yeah.
Right.
And we knew that people could only afford a $400 to $600 emergency. It's not gotten better. It has not. And it won't, because we don't know what's next. We have no idea what is being concocted as bioweapons. We have no idea what they're unearthing. The Arctic is melting. Like, we don't know what's coming down the pike next. And the time is really now for us to get healthcare, because we should have had it decades ago. And as Joy mentioned, Biden can sign 1881A, which is of the Social Security Act, and give us health care. But he isn't going to do that because he comes from a state where it has the most health insurance companies headquartered out of. He has been a godsend to these insurance and pharmaceutical companies throughout his entire career, not just as president, but throughout his entire career. So we're not going to get anything from this guy in office. That's why I think that we need to do a general strike.
And at the same time, this is, I guess, my PSA. We, as Americans, we are trained, and it is ingrained in us to feel like we are expendable, but we deserve to not just survive, to thrive. And there are so many people now who just exist, and they say, you know what, I got these bills, I got to go to work, I hate because I can't lose my insurance, things like that. please know you have worth. You are worth more. You deserve healthcare. You deserve to thrive. You deserve your family, friends, and everyone else in our country too as well. And the importance of that cannot be overstated, even subconsciously. So many of us are just like, you know what? You hear, ever since COVID started, you hear people say things like survival of the fittest and thinning the herd. That is so fucking ignorant. That is so ignorant. Yeah. Everyone deserves to thrive. Everyone deserves healthcare. And I guess my plea to everyone would be, you know, with this formal complaint, we are taking testimonials. We have people sending us videos of their personal stories. And it's incredibly powerful. And the important thing with that is UN is very, you know, used to like statistics and percentages, and people are desensitized to that. If they have to watch videos of people breaking down and saying, look, I had to file bankruptcy. I had to keep a job that was like mentally destroying me because I couldn't lose my health care. Things like that. That's the kind of stuff they need to see. They need to see just how it literally ruins people's lives. So if you take one thing from this, please send us your video testimonial. If you're not comfortable on camera, you can type something up. I just want to give a disclaimer that if you say things like fuck the Democrats, yes, I'm with you, but we can't use it. It has to be, you know, in the scope. It has to be, this happened to me, this was the effects of it, things like that. But yeah, M4M4ALL.org. We appreciate it, because with millions of people having stories, we should be able to get a lot of submissions. So this is your chance to be heard. This is your chance to be part of history and to really fight for healthcare justice.
Yeah, definitely. I have it shared on my screen right now. It says, send us your healthcare stories to be included in the complaint with the UN Human Rights Council against the U.S. government for denying your right to health care. Says healthcare includes medical, dental, vision, hearing, mental health, reproductive health, pharmaceuticals, gender-related health. This is to anybody who's trans out there. Right. Medical and assistive devices, long-term home and assistive care, alternative medicine, and more. So yes, this is deeply important. And one of the things I also want to ask, just like I asked, you know, last panel, and, you know, I'm going to start off with you, Elizabeth, is as far as being an activist is concerned, what are some of the best practice advice and what is the best advice that you can give to people who want to dive into healthcare or activism, period, but if they specifically want to get into healthcare?
I would say don't let yourself get caught up in the culture war. Everyone deserves healthcare, so you're fighting for everyone, regardless whether you agree with them or not. There's plenty of people that I disagree with on many other things, but we agree with on healthcare, and we fight together. So don't pigeonhole yourself and put yourself in an echo chamber with people who are just interested in hearing what you have to say. Reach out to other organizations. I actually will admit I grew up as a conservative. I was very right-leaning, you know, growing up in the country. We listened to Rush Limbaugh and Lars Larson and all of that. Like, yeah, crazy right-wing. I have insane stories about my father. But once I moved out of the country and, you know, had life experiences, everything about my perspective on life changed. I got to know people better and realize we're all more alike than we think we are. We just have small little intricacies that we disagree on from time to time, but it is okay to fight together for things that we believe in. Because honestly, we need to stop putting these politicians up on pedestals and hero worshiping them and thinking that they're going to get things done for us. They're not, regardless of who you are, what party you're running with. And I know I respect people who are third party, but with no election integrity in this country, it's going to be incredibly difficult for us to, flood the House and the Senate with people who are going to get things accomplished. We need to do this from the outside. And the only way that we're going to do that is working together for each other. And it's okay to disagree with people on things. One of the things that we fight for here at March for Medicare for All is for gender-related health, those who are transitioning to have the care that they need, whether that be mental health or that be the medications that you take for transitioning, what have you. And some will disagree with that. I know a lot of people that I grew up with that are conservatives are going to be against that. Same with abortion. We believe that abortion should be free. It is a right. That's okay to disagree on that. But understand that there would be services in this legislation that will help you and yours. It's okay for you to not go get an abortion. It's okay for you to not to transition. But other people are humans too, and they have that right. So we need to just remember that. And, as I mentioned earlier on, I don't really consider myself an activist. I really consider myself more of a volunteer to this nation by fighting for healthcare. I have a background of volunteerism my entire life. From being a young girl, I was the junior auxiliary president of the American Legion Post 122, and I would gather up girls in the community. We would spend our weekends sewing quilts to take to veterans up at the VA. I've done spaghetti feeds, hamburger feeds, bingo nights, fundraisers, car washes. My experience in the dental field is doing like Project Homeless, Homeless Veterans Stand Down, Dentistry from the Heart, compassion clinics. And I'll tell you, one of the hardest things to do is to tell people who have been standing in a line from 3 a.m. for a first come, first serve free clinic, free at the point of service, medical, dental, vision, mental health, all sorts of things, that the clinic is over and they will not be treated today. That is the most difficult thing to have to tell somebody. And so we really need to dig into our empathy and our compassion for one another and remember that our neighbor is not our enemy. The powers that be are, and we need to work together to fight them.
Thank you so much. I'm going to be moving to Mary for this same question. What advice do you have to people who want to get into the activist, organizer, and volunteer work?
I guess I would say that you definitely should look and find other people who have your same passion. And also bear in mind that as human beings, all of our rights are interrelated, right? Healthcare, housing, education. You can't exist it doesn't exist in a vacuum. If I'm not healthy, I probably can't pay my rent. And if I'm not healthy, I certainly can't get a job, let alone a living wage. So we have to recognize that we all have a lot in common. And to Elizabeth's point, we may not agree on every detail, but we need to come together, because the only way we can build power in what we seek to accomplish is in numbers. And I don't mean numbers as in get 3,000 people to sign your petition. I mean numbers as in the number of relationships we have, because the only way, to me, that we can lift up our humanity and act in favor of the rights that we have as humans is if we relate to people individually, which is why stories are so important. Like numbers on a piece of paper, so what, right? In our state, we do, instead of when the legislators convene and there's a bill that we want, instead of like having people sign a petition of a piece of paper, we have what we call photo petitions, which is where we go out to public places and we take pictures of families where you can see their faces, okay, or individuals, and they're holding a sign saying what they need to exist with dignity as a human being in our community. And we take those pictures and names and addresses, we send those to the legislators. That works a lot better because there's something about connecting with the heart. You know, I can remember, I don't remember how long ago it was, and not long enough ago, when one of the crazy candidates was on there talking about healthcare and people that couldn't afford things, and some of the audience were going, let them die, let them die. And I was appalled. And I also thought, I'll bet you if they had someone who was dying walk out there and say, please, please help me, I don't think anyone, well, that might not be true. There might be crazy people that would, but all those people that were chanting, let them die, let them die, I really don't believe they would have. So it's all about personal interrelations, whether it's for organizing or volunteerism or activism, and empowering other people, whether you have to stand next to them, in front of them, or behind them, which is all going to take place at a different point in their activism. And then the next thing I would say that we have to be ready for, and I am not admitting defeat on this, don't get me wrong, but after more than a half a century of activism, I can tell you that when I started out, it was like, oh yeah, in 5 years, you know, racism's going to be gone, you know, no more whites only signs, no more, you know. Well, guess what? I mean, we're still there, right? Now, there's been some progression, not enough, of course, but it breaks your heart every time you launch a campaign and don't get all that you want, right? But sometimes if the public recognition is good, you know that you can use that as a building block on the next ones. So like for me, for example, and I'm an old lady right now, but if my great grandchildren live in the kind of world that I work towards, I'll be so happy. So we can't give up the fight. We can't get angry and disappointed. We have to understand that we have to stay with it. And we have to have more and more people coming in of all ages, so that when one of us goes, the next one is right there to pick up. And that's the only way we're ever going to win.
Thank you so much. Joy, same thing to you. What tips and advice would you give to people who are diving into this?
I was on the last panel, so I'll give a different answer. So I think, you know, one of the main things I would say is please fight for equity. Please fight for all, not just certain state borders, not just, you know, immigrant people who are residents and not immigrants, not just people with certain incomes, not just incrementalism and no. Demand what we deserve. Demand it. Don't ask. As Americans, we ask. No more asking. Make politicians nervous. Make them feel uncomfortable. Why would they change when everyone's still like, vote blue no matter who? Why would they change? Go to those town halls. Hold them accountable. Ask to meet with them.
Yep.
This is how things are done. This is what happens. Nothing has ever happened from electoral politics. People are saying they support Medicare for all, and are we even closer? Think outside candidates. If you want to vote, cool, go ahead, volunteer. I don't care. But don't think it's going to happen through that. It's not. So I guess that's my thing. Do it with equity in mind. Do it for all. You know, think outside electoralism. And also, if you organize, please, and this is something I'm so proud of M4M4ALL for doing since day one, please have people who are disabled, people of color, poor, LGBTQIA. These people should be the front of your movement. These people should be on your team. These people should be your speakers. this doesn't happen. So I'm so proud of us that we have done that from day one. Please do that. It's so freaking important.
Thank you so much. And Martha, advice, please.
I might have a different perspective as a person who's been both activist and then a lawyer, but not a legislator. I think that actually we do have bills in Congress for national improved Medicare for all. So I would not say that it's worthless to do legislative work. But unfortunately, the way legislative work is done is not, it's lobbying rather than building political power. So that's one of my pieces of advice, that people have to understand doing legislative work differently, that what you are demanding is that people who represent you are accountable to you, and that I use you as more than an individual issue. And what I see repeatedly is that organizations have meetings with legislators, but they don't continue to badger them or to hold them accountable. You know, it's just, I've been on so many delegations where you'll have a meeting and then they say they'll get back to you. Of course, they never get back to you, or if they do, it's just like nothing, or you get a letter that says nothing. And then people give up. They give up. They don't keep demanding. They're not doing it week in, week out, saying, how come you didn't? Okay, you know, how come you're not co-sponsoring that bill to end sanctions against Cuba and make Cuba, you know, to withdraw the designation as a terrorist state, for example? I'm just using an example. So I think this is a problem of our not having enough confidence in ourselves and expectations. And we need to like rethink that, because that goes along with working at the base on the ground. And I can also say, you know, thinking about my role, I think education is really important. Thinking about my role with the education for the protests against the WTO in 1999. I was a labor educator, and, you know, we got 50,000 people out here in Seattle and we shut the thing down. We did something really amazing. And we were surprised at what was, there were several different approaches. You have to have multiple approaches. You have the people who do the direct confrontation, who are willing to get arrested and go and be on trial for their, you know, to do civil disobedience. You have people doing education. You mobilize more people, get them out in the streets. I think that one of the things we have to do more of is to raise people's expectations that we can have a national health system, that people are so propagandized that it's impossible that they believe it, you know. So that's one of our jobs, is to raise expectations and not to give up. The other thing that I would just like to mention is the importance of building unity across movements. And people have talked about this as well. But when I see the right, we're talking about the right to health, and the right to health is like, it's amazing how interrelated this is. This is, you know, human rights are interconnected and interdependent. The right to an adequate standard of living, the right to a clean environment, these are all, the right to housing, these are all so connected to the right to health. And so, and healthcare, you know, within the human rights framework, the right to healthcare is a subset of the right to health, which is a much broader idea. And it includes, you know, having a healthy planet for all species, not just humans. So I think that one of the things that we can all push ourselves to do is to continually try to figure out what other movements we can bring ourselves together with, and how we can explain what we're doing in light of what they're doing and find common ground. Because what I see is that it's coalition building and building a movement of movements that is the real task here, because we have lots of small movements. And for example, like the reproductive rights focus now is not really focusing on the right to health care. Well, reproductive rights exist within the right to health care. You know, it's right to health care is comprehensive and includes all of these reproductive rights and gender related rights. So I just, you know, I think that is one of the most critical things that we can do, is to try to, whatever you're working on, you know, try to figure out how you can expand who you relate to and what movements you're working with, and to bring into whatever conversation you're involved in, why it's important for us to have a national single payer system. It's amazing. You can talk to anybody on the bus or wherever, and you'll find that almost everybody believes that we should have a national healthcare system. You know, it's just like, you can see that if you reach out. And I think, you know, we have to get out of our isolation.
And thank you to people like Poor People's Campaign and, you know, all the incredible organizations who have signed on to support this UN action.
National Single Payer, Real Progressives, National Lawyers Guild, PNHP, Students for a National Health Program as well. You know, if you are a member of an organization that you think should be involved in this filing, please reach out to us. You can submit an email message through the website. You can also just email M4M4ALL@M4M4ALL.org. I'll also tell you that when you submit a story through the website, it doesn't just go into an abyss. It actually is read by myself and the women on this panel, and we cry tears together reading these stories. And, you know, it is heartbreaking to see all of these people hurting. And I really glean from, you know, the information everyone shared is that we need to make these politicians as uncomfortable as we are. And this is a marathon. This is not a sprint. So make sure that you take care of yourself when you are an activist. You need to care for yourself so you can care for others. And so you need to remember that also.
I would like to just do a few chats that's have been talked about. There's a couple I missed in the last hour, so I want to make sure I get to that as well. Brian Shea says disabled people are isolated. That's a material factor that organizers in our community have to deal with. So is being poor. Thank you to Angela, Joe, and Savage for your work. Thank you so much for that. Also, this one is from John Chaos, says, at Revolutionary Blackout, please explicitly include rural health care.
Absolutely.
So, yeah, and you said you were a country girl, so
I'm country. I'm a little country bumpkin over here.
And that's one of the things we really, you know, are trying to change, because it's going down the tubes. We need it. That for rural areas, you know, might actually make the difference. There's initiatives all around the country, like in rural Wisconsin, demanding their legislators call for a national Medicare for all system.
So, and a lot of people are going to lose Medicaid. Don't forget that. A lot of people are going to be losing their Medicaid. It's going to be bad.
Well, and that's only in the states that accepted the expansion. There's 24 states in this country right now, I think, that maybe it's 16. I can't remember at this time, but that didn't even accept the Medicaid expansion from the Affordable Care Act being passed. They're still fighting. Those activists are still fighting in their state to expand Medicaid. And I can't recall, GB, are you in Georgia or Alabama?
I'm in Florida.
You're in Florida. So, and Florida is a state that did not accept the Medicaid expansion. Is that correct? You know?
I don't think so. But yeah, it's horrible here.
Okay. Yeah.
So yeah.
Well,
DeSantis is my governor.
Yes, we know about him.
That says it all.
Maybe he didn't sign on.
This past week there was the expansion for 3 more months of the emergency, public health emergency, but they expect that 15 million people will lose their health care if that isn't extended past the 3 months.
I just saw a question in the comments that I'd like to address briefly, if I might.
Sure.
And it said, didn't one state already pass universal health care? And the answer to that is yes, and it would be Vermont, where I live. And it took us a number of years to do it. However, it's a good lesson in why it doesn't work to get states to do it. Because our governor at the time, who was a Democrat, all of a sudden at the last minute, when the financing plan and everything else was supposed to be presented on a PowerPoint to the committee that was administering it, the day before, he had a meeting with insurance executives, closed door meeting in his office. We were standing there waiting to present this to the committee and the legislators, and his employee, who was his healthcare person, got a text message from him saying, "Don't present, we're changing it." Now, it's a law, okay? But that being said, he's a politician. And of course, he was told, the scoop is, I wasn't there, but he was apparently told that he wouldn't win the next election as governor if he actually let this be implemented. And so instead, he delayed it and delayed it and delayed it until he was out of office. And now we don't have it anymore, even though it's a law. So that's a good example of why we need to approach this nationally.
Yeah, and then just a reminder, by definition, a single state passing some form of enhanced health care is not Medicare for all.
No,
it's
right,
Medicare for some within an arbitrary border.
Yes,
and that's not recognized by the United Nations. The United States is considered a state, member of the United Nations. So our entire country, the United States, is considered one single state, all of us together within these borders. And that is how we are represented with the United Nations. And so this really has to be a national filing because it's for all people. And we saw, similar to what Mary mentioned, same thing happened down in California, AB 1400. The co-author of that bill, Ash Kalra, he I think is still an assembly member, and careerism is more important to people. So he is a co-author of that bill and pulled it off the floor before the Democratic majority voted on it. So they don't have anything down in California, and that's the 5th largest economy in the world. So,
all you need to do is buy one politician, just one. That's it.
I just want to say something about this national and state discussion, because I don't want people to go away with the idea that you could actually have even a universal system at the state level, because states have to balance their budgets. We're in a horrible austerity time now, and things are getting chopped right and left, and it will get worse. The federal government can, it's not an issue with a national system. So that's a really important reason why you need to have, and when you consider how capitalism is evolving in the US, and the fact that private equity is getting to have more and more power in the health industry, I think you have to recognize that only a national federal government can actually rope this in.
Well, and that's the thing, is a lot of people don't realize that a state budget is ran like a household budget. You have money coming in, you have bills going out. That's how it works for a state. you only have the currency that's within your borders of that state, from whether it, agriculture that was sold, or, whatever was produced in that state that created the money to spend on the services. And then by the end of that fiscal year, you have to make sure that your budget lines up. Most states are in a budgetary downfall, meaning they're already in the negative. There's no way possible that they're ever going to be able to achieve anything as an individual state related to healthcare, enhanced healthcare. So now on the other spectrum is the United States government. We create our own currency in this country. We create the US dollar. There's no other country that creates the US dollar. So healthcare would be a service and billed and voted on just like the debt for the military spending. They increase the debt limit so they can spend more on the military. We can do the same thing for healthcare. And by cutting out the middlemen of the insurance and the pharmaceutical companies, we actually would be saving more money in this country than we're currently spending. And that's been proven twice by a Republican majority congressional budget office, that it is more cost effective to have a national healthcare program than what we currently have. Not only would people have better care, but everyone would have that care. You wouldn't have to rely on a crappy job to have shitty insurance. You have health care. When you need it, you use it. And the government doesn't decide how your care goes. They have no conversation whatsoever. It is a conversation between you and your provider, and then the government pays the bill. That's it.
Right, absolutely. Yeah. And also, please keep in mind that anyone who says if it's state by state does not have to go through Congress, that is an absolute lie. To say that a state will reallocate their Medicare budget to a Medicare for all budget, that is not possible without a waiver. Such a waiver does not exist. And to get it to exist, you have to write it and get it to Congress. So that is a lie. That is not possible. So even if you vote on it, doesn't matter. But I want people to read some of these state propositions, because there's a lot of caveats and a lot of asterisks, and it's not single payer. I've yet to see one that's single payer. And it's already in what, like 7 states or something? So I think, people need to realize that 1 out of 50 is nothing more than incrementalism. And we need to start thinking about everyone. And if we really believe healthcare is a human right, or if we think that statement should have asterisk after it.
Well, so, can I just make one other remark related to this?
Sure.
To do a state healthcare system, some kind of more universal healthcare system at a state level, every state wants to get Medicare money because that will make it possible to have the system. But to get Medicare money means the state has to use the privatized program, Medicare Advantage, to turn the money over into the state. So that would undo one of the best single payer systems we have, which is Medicare. So privatizing Medicare is to have one state program is not a recipe for equity or a viable system. So that's, I think equity gets sacrificed when you can't do a national single payer system. That's the bottom line.
And 24 states don't have ballot access, so fuck us. We have no ballot initiatives, so oh well. Fuck us.
I got you. Well, I want to get to some chats, but I'll get to that right after. But for all of you, if you can just give us within 1 minute, give us your parting thoughts as well as where they can find you. We're going to start with Mary.
Hi. I want to say I really appreciate the opportunity for us to all come together here. And I'm hoping that all the folks who are with us in this venue are going to talk to their friends about getting together, because we need to come together in order to have the power to get this done. And so that's sort of my parting thought, and I forgot what the other question was. I'm sorry.
Where can we find you?
Oh, all right. Where can they find me? So you can find me on Facebook, or you can find me. I'm Mary Garish, Gerisch. Also, Elizabeth and Joy have my contact information. I'm happy to answer any questions via email or in whatever. If it's easier to call, I don't mind them giving somebody my phone number if the person has a question. Just please get involved. Thanks.
All right. Thank you so much. Elizabeth, please.
I just wanted to take this time to really thank RBN again for everything that you've already done and what you continue to do, like I said, virtually and in person. You guys are inspiring the future, and I really do believe that it's going to take a revolution of like-minded people within RBN and others who are on the same, wavelength to get things done, because we cannot rely on the system the way that it currently exists. And I also just wanted to take a moment too to shout out the others at March Medicare for All who do a lot of the behind the scenes stuff. Shane, who does most of our graphics. Logan also helps with them as well. Lauren, Ricky, Virginia, Josh, it's Zach. He's our newest National Steering Committee member, and he is only 17. He runs our TikTok and puts those together. Yeah. So I just really wanted to shout out. We have others as well, like Louise and Steve and Joyce. Just a lot of people that come to our meetings and help with all kinds of projects and things that we're doing for organizing. It's just, we really do need to come together and fight for each other, because if we don't, then they continue to win, and we can't allow that anymore. We just can't.
All right. Thank you so very much. Martha?
Oh, well, thank you all very much for inviting us to participate in this panel. And I really also, like Elizabeth, appreciate all the work that goes on to make it possible for us to be here and to do our work, especially trying to push forward on this UN complaint, which has been quite a project. We've been at it now for, at least I have, for about a year. So persistence pays off, I think, and we have to persist, because we will win if we persist. You can reach me through March for Medicare for All, I'll be working with the committee and the people doing, looking at your testimonies and videos, so we can have the best possible complaint submitted to the Human Rights Council. Also, you can get in touch with me at my website. It's marthalschmidt.net. And I'm happy to answer questions about human rights, or to do educational work with groups. I'm always willing to share my knowledge and information about human rights and activism, and how human rights law can be used in a popular way.
Thank you so very much. And Joy.
Why do you say it like that?
Because you know why. You know why. Now go ahead with your bad self.
So I have YouTube and Rockfin, and I'm on Real Progress in Action every Monday. But I do shows several times a week. I've had a show for over 5 years. You can also contact me through my Twitter, and my DMs are open if you ever want to, ask questions about Medicare for All. You need me to promote your mutual aid. Please don't hesitate to ask. I always want to help people. And if you do one thing to take from this, just please send us your stories. If you know anyone with a story, even if you don't have it, or it's a family member and you want to share on their perspective, we just need more people to be sending their stories, because we want you guys to be heard. And now I see Sabby. Thank you so much. I gave you a shout out last panel because you and JB have been with Medicare for All, March for Medicare for All, from day one. And we know it and we appreciate it. So thank you
so much.
Yeah, absolutely. I mean, everybody at RBN. I actually got to meet CJ out in Los Angeles in July of 21. He was just out there live streaming. I was like, oh my gosh, is that CJ? Oh my gosh. Because I'm actually from Washington State. So I drove down. I was an organizer for that LA action. And I was like, oh my gosh, it's CJ in real life. You guys are all amazing. Thank you for everything.
Yeah. He's taller than people think, so. But I just want to thank all of you. It was a privilege to have you all on. I cannot wait to have more conversations like this in the future. And thank you so much for being here with us.
Thank you.
With that,
thanks so much. We appreciate it. Gosh.
Much love,
yes, we
you guys.
do. Thank you so much.
All right. Take care. Bye-bye.